Hello, this is the lecture for Lab 1 for AP120. In my lectures, I will refer to the lab manual and changes to be made to the lab manual. However, if you are taking this course online, then all the information you need will be in the Canvas shell. However, if you do get the lab manual, it will include activities that may help reinforce the information. So I'm not saying don't buy it, but it's not critical if you're only taking this course online. All right, the anatomical position. The anatomical position is where the patient is facing you forward, legs planted on the ground, arms on either side, and the palms facing forward, facing anteriorly. That is the anatomical position. Whenever we refer to where different structures are to each other, we are assuming the patient is in the anatomical position. Directional terms. Directional terms are used to help us either talk about the surfaces of a structure or to refer to the position of two or more structures to each other. So for instance, A and B here are representing anterior and posterior. Anterior is toward the front of the person or structure. So anterior, closer to the chest, the stomach, the knee. Those are all anterior structures on the anterior surface. And then posterior is toward the back and the buttocks. So for instance, the nose is anterior to the back of the head. The shoulder blade is posterior to the chest here. Over here, we're looking at the terms superior and inferior. Superior means toward the top of the head. Inferior means more closer to the bottom of the feet. So, for instance, the belly button is inferior to the chin, while the nose is superior to the chin. Then we have the terms proximal and, we have the terms medial and lateral. So this line here is representing the midline cutting through the body to give us the right and left pieces that are about the same. So medial means closer to the midline, lateral means further away from the midline. So for instance, the wrist is lateral to the hip here, or the eye is medial to the ear. The eye is closer to the midline than the ear. And then over here we have proximal and distal. C and D here representing proximal and distal. Proximal and distal are only for limbs of the body. So if you're talking about structures in one limb, one of the arms, one of the legs, then you use proximal and distal. They are replacing superior and inferior. So you'd still have anterior and posterior and medial and lateral in the limbs, but instead of superior, inferior, use proximal and distal. And proximal means closer to where the limb attaches to the trunk of the body. Distal means further away from where the limb attaches to the trunk of the body. So for instance, the elbow is proximal to the wrist. It is closer to where the limb attaches to the trunk of the body than the wrist is. Or the elbow is distal to the shoulder. The elbow is further away from where the limb attaches to the trunk of the body than the shoulder is. We also have the terms superficial and deep. Deep means further away from the surface of the body or structure. Superficial means closer to the surface. This often is used to refer to things surrounding each other, like layers of an organ. In this example here, where we're looking at the thoracic cavity via transverse section, we see the heart here. The heart is deep to the skin. Skin, as you can see, goes completely around, so it is surrounding the heart. The heart is deep to the skin, or the skin is superficial to the heart. The skin is closer to the surface than the heart is. We also have right and left. When you're referring to right and left, you're referring to the patient's right and left, not your own right and left. So be sure to keep that in mind for the rare occasions where you'll need to say right, that something is right or something is left. All right, we also have the concept of planes and sections with our Modern technology and the ability to look into the body with CT scans, MRI scans, we are able to get views of inside the body. So the plane is an imaginary sheet that cuts through the body, and the section is what you actually see in that slice. So for instance, here is a frontal section of the head. Frontal section gives you a plane. Frontal plane gives you a front and a back piece. Here's the frontal section that you would see. So we can see the brain, the eyeballs, nasal cavity. Then we have a transverse section. A transverse plane will cut through the structure, say the head in this case, giving you a superior and inferior piece, a top and bottom piece. And when the plane cuts through, you get the transverse section. So in this case, looking at the head, we can see the brain again, the eyes again, nasal cavity, but it looks very different from the frontal section. And then finally, we have the mid-sagittal section. When you have a mid-sagittal plane cut through the body or the structure, it's cutting through the midline, giving approximately equal right and left pieces. And then when you look at that section, this is the mid-sagittal section. So here we can see the brain, we can see the nasal cavity, but we can't see the eyes with this section. If the plane cutting through is off-center, so you're not getting two relatively equal pieces, then it's often called a sagittal section. So a sagittal section, a sagittal plane is off-center, not on the midline. Mid-sagittal plane, mid-sagittal section cuts through the midline. Cavities. Cavities are spaces within the body where we find lots of soft, delicate organs. So in the skull, we have the cranial cavity. So the cranial cavity houses the brain. And then coming off of that directly is the vertebral canal. The vertebral canal is where we'll find the spinal cord. So cranial cavity, brain, vertebral canal, spinal cord, they are both cavities, even though vertebral canal is not called a cavity. Then over here we have the thoracic cavity in the chest, the thoracic cavity where we'll find the heart, the lungs, additional structures. Below that, or inferior to that, is the abdominal cavity. There's a structure, the diaphragm, which is a thin muscular sheet that physically separates the thoracic cavity from the abdominal cavity. Abdominal cavity, we will find things like the stomach, the liver, the kidneys, the bulk of the intestines. The inferior end of the abdominal cavity meets with the superior end of the pelvic cavity. This occurs about at the top of the hips. The pelvic cavity is considered a separate cavity where you find the urinary bladder, the uterus and ovaries, if you have them. But there is no actual structure separating the abdominal cavity from the pelvic cavity. So sometimes they're referred collectively together as the abdominopelvic cavity. So both of them together, abdominal pelvic cavity. Now, if we look at the thoracic cavity, again, we see that it can be broken down into 4 smaller cavities. So the thoracic cavity has 2 pleural cavities, one for each lung. So each lung is surrounded by the pleural membrane, forming a pleural cavity. So each lung has is within the pleural cavity. Then we have the heart. The heart is in the pericardial cavity. Heart is surrounded by a membrane called the pericardium, and that cavity formed that membrane gives you the pericardial cavity where the heart is found. And then finally we have the mediastinum. The mediastinum is the space between the lungs. So the mediastinum is not defined by a membrane, it is just the space in the thoracic cavity between the lungs. And so what this means is the heart, for instance, is in 3 different cavities. It's in the thoracic cavity, the big one. It's within the pericardial cavity formed by the membrane surrounding it, and it is within the mediastinum. The pleural cavities in the pericardial cavity are formed by serous membranes, as I've already mentioned. So serous membranes have 2 layers. They have a visceral layer that lies on the organ, and they have a parietal layer that is exposed to things surrounding that organ. And between them is a thin little space filled with the serous fluid. So visceral layer, parietal layer, serous fluid in between. Pericardium is the same way. It has the visceral pericardium lying on the heart and the parietal pericardium exposed to the structures surrounding it. Serous membranes are important because they help reduce the friction, the damage that the lungs and heart experience when they're constantly moving for breathing and beating. All right, we will take a pause here and